Alright, neuro nerds, let's talk about post-polio syndrome. So, it's kind of ineffective to talk about post-polio syndrome without first talking about polio, or poliomyelitis, which has been eradicated in the United States. Hopefully it will continue to remain eradicated as long as people are getting their children vaccinated for polio, so that way we don't have to deal with this terrible, terrible disease that put many people in iron lungs. But essentially the way that polio worked is it entered the body through the mouth, it then replicated itself in the oropharynx and would enter the lymphatic system. Once it was in the lymphatic system, it would be introduced to the bloodstream, and it would either make its way to the central nervous system via the bloodstream or via infection of the peripheral nervous system. And from here it would travel to the spinal cord and the brainstem and destroy or damage the alpha motor neurons in the anterior horn cells of the spinal cord and the brainstem. This led to flaccid paralysis of the muscles that were applied by the motor neurons affected by the poliomyelitis or the poliovirus, and it also just presented, because it's affecting the anterior horn cell, it presented as a lower motor neuron disease. And then recovery from this disease process was impacted by the number of motor neurons that recovered after the virus had run its course, collateral sprouting, which I'll go into on the next slide, and then muscle hypertrophy. Muscle hypertrophy is a typical compensation that happens when we lose innervation to a certain part of the muscle, so you get greater amounts of hypertrophy of the remaining innervated muscle fibers, and that can help compensate for the lost innervation of certain amounts of the muscle fibers. So this is an image illustrating collateral sprouting. So you have 3 neurons there, each with their axons, and then sprouts coming off of the axons, and presumably those are going to muscle fibers. And so imagine each section that these neurons innervate is a motor unit, okay? In that B picture, you get the acute stage of polio, and you see that middle neuron is withering away. That means that the weakness that a person experiences in acute polio is because the motor units that middle neuron supplied innervation to no longer have innervation. And so those muscle fibers stop firing, and so you get weakness because you have less of the muscle overall being recruited. You see what happens during recovery is that you see these neurons start having greater amounts of sprouting, and they begin to supply the motor units that the middle neuron in picture B had been supplying. So basically these remaining neurons take over a greater volume of the muscle. Just know that the remaining neurons that are functioning properly take over a greater portion of innervating that muscle. So the hallmark symptom of post-polio syndrome is new weakness, which may occur in muscles that were previously affected by polio or in muscles that were thought to be completely normal. The reason that this weakness is thought to happen is not fully understood, but as we get older, we all go through a certain amount of muscle denervation or just neuron degradation. And so basically in that previous picture, in picture D, you see that one of the neurons that initially had done collateral sprouting to take over a greater portion of the muscle, now it's starting to degenerate just as a normal process of aging, and so it had originally taken over a greater area or greater volume of the muscle, but now that it's dying, you're getting even more weakness because it was initially responsible for a certain area, it took over to help make up for the dead neuron up above, now it's dying as a regular aging process, and so you're going to get much more dramatic weakness because now you've got a greater loss of innervation to that muscle. So 25 to 40% of patients surviving polio will experience post-polio syndrome 15 to 40 years after their initial infection. So not everyone that had polio will experience post-polio, but it's a pretty large percentage of people that are expected to begin to experience that post-polio syndrome. So, as the name sort of suggests, you get it as a result of having had polio. So if polio remains eradicated in the US, then once the last person who had polio dies, this will also die. The clinical presentation of post-polio syndrome is fatigue, weakness, joint and muscle pain, new respiratory difficulties, and cold intolerance. The fatigue, just because you have smaller areas of the muscles that are able to function, and so they're going to get overworked more quickly. Weakness as a result, at least in part, due to the death of the neurons that had initially collaterally sprouted, and now you have greater denervation of the muscles. Joint and muscle pain makes sense. Joint pain because you have less support surrounding the joints, and so you have a lot of greater forces going through your static structures. New respiratory difficulties, presuming that your accessory muscles and your diaphragm also potentially become denervated. The course of this disease process is a steady progression, approximately a loss of weakness around 1 to 2% per year. There's no effective medical or pharmacological treatments to post-polio syndrome, so it's largely left up to the physician trained in neuromuscular disorders, and then PT, OT, and potentially speech if there was bulbar weakness with their polio and or post-polio syndrome. So essentially we're approaching this similar to the way we would approach ALS, is in therapy in reverse, and we're just going to help get them the equipment they need, if they need equipment, to help maintain their function. And then also getting them plugged into support groups just so they can have a body of individuals that are in a similar situation as them. And I would say that's something we should be doing for all of our neurologic patients anyway. So if you guys have any questions about post-polio, or you just have a comment about what you would like to learn about next, I have a couple other things I want to touch on, and one at the request of one of my followers, but I want to know, what do you guys want to learn about? So please ask questions, help me to be able to create more content about things that you want to learn about.